The weak and painful shoulder is defined as a shoulder that is painful and possibly weak through active movement and or against resistance, but has minimal loss of range of movement. This is by far the most common presentation of shoulder pain, partly because of how many structures can be the source of that pain. This is also both where the shoulder can be confusing and simplified. It is well established that special tests are poor at isolating individual pain structures, and it is difficult to isolate the cuff from other shoulder structures. More importantly, isolating specific structures as the source of pain doesn't change our approach to the weak and painful shoulder, hence why it can be simplified. We still base our management around finding ways to calm the pain down, while simultaneously beginning down the path of building up tissue loading capacity. The classic example of this is that pathology on imaging does not always dictate how a shoulder presents clinically. The risk of a full thickness tear of your rotator cuff increases every decade of your life to a level of 50% after the age of 60. In fact, you're twice as likely to have one without pain than you are with pain. What this demonstrates is that the relationship between painful structures in the shoulder and pathology isn't always clear, and research tells us that we're not very good at isolating those structures with testing anyway. These structures causing pain include the cuff itself, the acromioclavicular joint, the labrum, the long head of biceps tendon, and bursa. But only the cuff, ACJ, and SLAP lesions have test clusters that are reliable. I've perhaps taken the longer way around, but this category comes back to a simple point. You don't need to isolate a specific diagnosis to effectively treat the weak and painful shoulder, because research suggests that our management does not need to change between structures. Subjectively, we're looking at two population groups. The first is the younger population, and their weak and painful shoulder will often be associated with a heavy increase in load. In the older population, generally there'll be some sort of external factor, such as a day spent in the garden, something that will take them over the edge, which can also be related to and impacted by other factors such as emotional stress or disruption, financial stress, or work stress. Something that might trigger a cortisol release that increases their sensitivity to pain. Objectively, we're looking to keep things simple, looking for pain on active range of movement or pain on resistance with flexion, abduction, or external rotation. Remember that in this guide, we're less concerned with specific isolation of structures, and while there are good clusters of tests for the cuff, the ACJ, and the labrum, broader categorization of the weak and painful shoulder can suffice for successful treatment.